Hello, good afternoon, welcome back.
Good afternoon, sir.
So we will start from where we left. What we saw was, I'll just draw it again. Isn't it? So the structure of the heart tube was somewhat like this, isn't it? This part is known as the bulbous cordis. This is the primitive ventricle. This is the primitive atrium. Okay, this is the sinus venosus. These are the horns of sinus venosus. This is the common cardinal vein. This is, what is this? This is the umbilical vein. What is this? This is the vitelline vein. So from here it is the input, this is the output, isn't it? Now again this bulbous cord is divided into three parts. Okay, the uppermost part is known as the truncus arteriosus. After that, the part is like a cone, so it is known as the conus cordis, and this is the proximal 1/3. So what the truncus arteriosus will form? The proximal part of aorta and pulmonary trunk. Okay. What the conus cordis will form? The outflow of the both the ventricles. Okay. What the proximal 1/3 will form? Anyone? The right ventricle. Primitive ventricle, left ventricle. Primitive atrium, both parts of both the atrias. Okay. Sinus venosus, we will see what happens to it. Okay. And you know, common cardinal vein draining the body, umbilical vein having its connection with the placenta, vitelline vein, the yolk sac. Okay, I think this picture is clear. Now, there is what happens, this whole tube is being formed by day 23rd. Okay, at the day 21st, the heart starts beating. Okay, now you see at the day 23rd, what will happen? There is looping. The superior part moves forwards and downwards, the inferior part moves upwards and backwards. So if it happens, and along with this there is elongation of this tube. Okay, there are different areas due to the difference in the cell divisions. Somewhere there is more division, somewhere there is less. So there are these areas, the outpocketings, which are being formed. Okay, So now they have to be there for their respective function. So the truncus arteriosus will be something like this. Okay, then comes the bulbus cordis, then comes the primitive ventricle. So the truncus arteriosus is somewhat like this. Then comes the bulbus cordis. This is the primitive ventricle. Posteriorly goes the atria along with the different parts of the sinus venosus. Okay, so this is how there is this looping. Okay, so what was this? This was truncus arteriosus. What was this? This was conus cordis. What was this? This was proximal 1/3. What was this? This was the primitive ventricle. What was here? The primitive atria. So if you see the heart, the atrias are lying posteriorly, okay, and the ventricle posteriorly and superiorly, and the ventricles are lying inferiorly and anteriorly. So is this picture clear?
Yes,
Yes,
sir.
yes, sir.
So you see now, so this part is clear. This is truncus arterius.
Yes,
So,
sir.
so now this is a whole tube, isn't it? This is a whole tube. So the structure is somewhat like this is a tube. Okay, the heart, the blood is okay moving along this tube. So we will just in embryology you should understand. Okay, you will have to memorize, but the first thing is you have to understand the concept. Now, blood is moving kaise? Like this, isn't it? So from here, there is the one. यहाँ से this will be where it will be connected. These will be connected on either side with the two dorsal aorta. Okay, it will be connected either side with the two dorsal aorta. Okay, let us just so these are the dorsal aorta. This will form the further big vessels. Okay, now you see, now what will happen? So this part is the truncus arteriosus forming the proximal part of aorta and the pulmonary trunk. This is the conus cordis. So the conus cordis will be forming the outflow of both the ventricles. But where are our ventricles? The proximal 1/3 is this one. So this is forming the right ventricle. Now what happens? These parts, they will start bulging out. Okay, these parts, they will start bulging out like that. So they will start bulging out. Okay, even the atrias which are going posteriorly, they will be bulging out. Okay, let us just, we will remove this thing, not needed. Okay, so the atrias are there lying posteriorly. Okay, now the canal, the blood is flowing again like this. Okay, so this part becomes the interventricular. So this is right ventricle future, this is left ventricle. So this interventricular canal. Okay, there becomes interventricular canal from where the blood will flow. Now the atria further, so you cannot see it from the back, I mean from the front. What you are seeing is from the back. So atria, sorry, these atria, they will further bulge. Okay, they will further bulge so that a part of it comes to lie in the opposite side. Okay, the bulbotruncal part, okay, or the conotruncal part, it further shifts to the left side. Now, therefore, we are we will get a picture somewhat like it almost lies now in the midline. Okay, it somewhere lies now in the midline. Okay, both the atrias from the posterior aspect are projecting into it. Okay, so these are the two atrias projecting from the posterior aspect. This is the interventricular canal. Now you see the left ventricle is only in communication with the atria. Which atria? The left atria. Okay, this is known as bulboventricular sulcus, which you can see from the outside, from the front. Later on, what happens? Some cell deaths occur here, so that remember what was this? This was the truncus arteriosus. What was this? This was the conus cordis, isn't it? Now the conus cordis has to be, it has to form the outflow of right also and left also. But previously it was only communicating with the right, then through it left, then. But now, since the bulboventricular part, the conotruncal part, okay, it moves towards the right. Now both the ventricles are having access to this. So now it has formed a common chamber. It is communicating with both the ventricles. Okay, so the bulboventricular sulcus, slowly it disappears, so that there is this conus cordis which is forming a direct communication with both of them. Now this picture, when you look at this picture, so the ventricles are lying anteriorly. Suppose you are seeing it from the sagittal view. This is the truncus arteriosus conus cordis. Posteriorly are the atrias. It is somewhat appears like that. Okay, and now initially this was the communication, but now the atrias also communicate with the individual ventricles separately. Okay, so this is communication from the right atria, this is communication from the left atria. Okay, how it is done? This is done by formation of some masses of mesenchymal tissue which are known as endocardial cushions. Endocardial cushions. So one endocardial cushion will come from like this here, another endocardial cushion will come like here. When both of them getting elongated and fused and fused and fused, so now the atrias are being separately communicated with the individual ventricles. Till here, is it okay? So now you see, so I'll just show you the pictures of how this is happening. Okay, so this was, if you remember, this was, what was this? The cardiogenic field, where in the splanchnic layer of the lateral plate mesoderm. The blood islands develop. Okay, these are the cardiac progenitor cells which develops into cardiac myocytes as well as the blood vessels. Okay, so once the blood vessels, I mean the inside of it is formed, there is an endocardium, there is a myocardium. Both are derived from the cardiogenic cells. Okay, from where they come from the epiblast, pass to the primitive node, and they surround by the side and in front of the neural plate. Initially it was in front of the stomatodium, but later on due to the cephalocaudal folding, it went to the thoracic region. Okay, now along with the cephalocaudal folding, there was the lateral folding due to the same thing, due to the overgrowth of the brain as well as the cephalocaudal folding, it went to the thoracic cavity. Now along with it, there is this lateral folding. Due to the lateral folding, both of the heart tubes become one tube. Okay, surrounded by a cavity which is the pericardial cavity. Now that tube has different parts which we already discussed, and it has started to get folded. Okay, once it gets folded, so this is how, so these are the veins inputs. Okay, vitelline and all those veins will be there. This is the heart tube, it's about to get fused. Okay, and it is connected to the dorsal aorta on either side. This is the gut which is being formed, and above it, this is the brain, the neuroectoderm. Okay, this is again all the veins. Yolk sac is being drained by the vitelline vein, umbilical vein in communication with the placenta, and the body is being drained by the common cardinal vein, which is again dividing into anterior and posterior. Now these are the different parts which we have already discussed. Okay, the same thing in the pericardial cavity, different sacs are being developed. Okay, now see, from the same cardiac progenitor cells, there is this endoderm, this and the mesoderm. Now, the endocardium and the mesocardium. Now that mesocardium will secrete a cardiac jelly, which will separate the endocardium from the mesocardium. Okay. Now, when the heart is being suspended in the pericardial cavity, posteriorly it is still attached, okay, to the foregut. Posteriorly it's still attached to the foregut. Okay, this part is known as the dorsal mesocardium. Okay, this is known as the dorsal mesocardium. Now this is the input, this is the output, or you can say this is the inflow, this is the outflow. Now there is programmed cell death in the dorsal mesocardium, which is known as apoptosis, and there is a gap being produced over here, and this, once the heart gets looped like that, now this gap will be forming a partition between the inflow and the outflow, and that is the future what? Anyone? This is the future, this will be the future what? The gap between inflow and the outflow. This will the future with sinus. Yesterday we discussed. This will form the future transverse sinus. Transverse sinus. Okay. Now this is how it is getting folded. You see, this is the truncus arteriosus bulbus cordis primitive ventricle. Okay. Then it will go to the back. Okay, same conotruncal. This is the right ventricle, future left ventricle. Okay, there, see, this is how they are going to the back. These are the atriums. This is the left ventricle. You are seeing it from the left side. The sinus venosus is opening into the atrium. Okay, this is, I think, an original picture. Okay, how this is the truncus arteriosus, the conus cordis. Okay, somewhere here is the future right ventricle. This is the future left ventricle, and see, two out pocketings from the posterior side. These are the primitive primitive atrias. Okay. Posterior to the atrius, the sinus venosus is still there. It is still opening over there. Okay. So I think, is it clear now? Is it clear?
Yes, sir.
So you see, one thing I have missed here is that there is still this sinus venosus which is opening here, isn't it? It should be communicated here. So this is the
Yes,
sinus
sir.
venosus. Okay, sinus venosus. Now, you see, I'll just show you in the here only. See, this is the common cardinal vein. Okay, posterior cardinal, anterior cardinal. This is the umbilical vein, which is right and left. So they are forming. This is the right horn. This is the left horn, and this is the body of the sinus venosus. Okay. Now what happens? There is a process. There is a phenomenon which develops. Okay, and that is left to right shunt. Okay, so due to this shunting, what happens? The left side of the sinus venosus almost disappears. What is remaining is only the right side. Okay, and thus the opening of the sinus venosus is shifted to the right. Only the right horn is opening. Okay, and this opening is directly there in the to the right atrium, posterior wall of the right atrium. If you remember, this was the body of the sinus venosus. Ultimately, the body where it is opening, the sinus venosus opening into the primitive atrium, isn't it? Now, once this part is almost due to the shunting, this is negligible, becomes negligible. Only the right horn will be opening into the atrium, so that you will get some picture, something like this. So vitelline vein gone, umbilical vein gone. In the right side, the umbilical vein is also obliterated. Okay, so the right vitelline vein is only opening into the atrium, and whatever is left from the left side becomes the coronary sinus and oblique vein of the left atrium. Okay, coronary sinus and oblique vein of the left atrium are the remnant of the left horn of the sinus venosus. Okay, now we will see when the right side opens into it, what happens. Okay, now let us just again, I'll try to draw over here. Now this picture, is it clear? These pictures, are they clear? Now let us just remove this so that we are seeing only what is happening with the and I'll just make it a little big. What is happening with the atrias over here? You see, again we will see the atria. So the atrias which are lying posteriorly are lying like that. Okay, so this is the atria. What is opening? So initially both the horns were opening, isn't it? With the various branches, inputs. So this opening, what will happen? The left side almost nil. There is nothing in the left side. Okay, almost it's gone. Something is there, but it's not yet again opening there. So almost you can say only the right horn is now opening into the posterior part of the right atrium. This part, is it clear? This is the right horn of the sinus venosus. Okay, now when you see this opening, this opens like this. The opening is somewhat like this. This is the opening. The blood is coming from here, from there to here. Okay, this is, what was this? This was the whole thing was the primitive atria. Now there is one chamber on the right, there is one chamber on the left. So it has divided, not yet divided, but it has come expanded towards the right and expanded towards the left. Okay. Now, what will happen is that, see, whenever a chamber, this sinus venosus is a separate chamber, it is opening into the, so whenever there is a junction of two chambers, in the junction there should be a fold, isn't it? So when the right horn of sinus venosus is forcing itself to open in the posterior part of the future right ventricle, there are these folds which are getting developed. Okay, the folds which are being developed, and these folds are known as the venous valves. Okay, so on the right side, on the left side, it will be left venous valve. On the right side, it will be the right venous valve. Okay, this part is clear. Shall I move on?
Yes, sir.
Hmm?
Yes, sir.
Are you getting it or not? Are you understanding or not? Are you getting these things? What I am drawing? Are you following?
Yes, sir.
So now this left venous valve and the right venous valve fuse together, okay, to form a septum, sort of a septum, and this septum, which is lying dorsocranially attached to the roof of the right ventricle, is known as the septum spurium. Okay, septum spurium. So both the valves superiorly forming the, what is this? This is the entry of the right horn of the sinus venosus to the right, future right atrium. Okay, so till here it is okay. Now we can further move a little bit to see how this, see, this atria is a common chamber now. Atria is a common chamber. So in this common chamber, they should now be divided into two. We need two atrias, isn't it? Right and left atrias. Both the atrias we need. And we have, what we have right now is the septum spurium. Okay, the opening of the right horn of sinus venosus as the different venous valves, right and left venous valves. Okay, now what is happening? There is a septum, okay, which is crescentric shaped and which comes out from the middle of the roof of the common atrial chamber. Okay, so if you look at it from the lateral aspect, if you suppose, if you see, this is the, or in the sagittal section, if you see, this is the atria. Suppose this is the atria. Okay, somewhere here are the atrioventricular cushions coming. Okay, so this septum, okay, this septum, so we have taken a sagittal section almost in the middle. So this septum comes out as a crescentric shaped septum. Okay, like that. It is coming all throughout in sagittal section. From the front view, how you will see? You will see like this. Okay, below there is the atrioventricular cushions. What will they be forming? They will be separating the atrias from the ventricles. What we have seen earlier. I have drawn one. So these are the AV cushions. Okay, and what is this? The first septum is the septum primum. Okay, so this is the septum primum. What is the shape? Crescentic shape. So there is a gap now in between the septum primum and the AV cushion. Okay, this gap is known as ostium primum. Okay, or apart, or foramen. Ostium means a foramen. Foramen or ostium primum. There is a gap. Now the blood is coming from the inferior vena cava. See, the inferior vena cava is to be developed here. So from the inferior vena cava, the blood is has to go to the left atrium. Okay, so there should be a free passage for blood to go from right to the left. And now from where it is going? It is going through this foramen or ostium primum. But what will happen? This has to form a septum, isn't it? This has to form a septum, so the septum will keep on growing. So it will keep on growing like that. Okay, growing like that. Again, it will keep on growing like that. What is this septum? This is the septum primum. So the ostium secundum is becoming, the ostium or the foramen primum is becoming smaller and smaller. Okay, so the blood from where it is passing? From here. Okay, now if the blood is if this part is completely formed, then there won't be a passage for the blood here, isn't it? So before this small ostium primum obliterates, there are some cell deaths. There are some areas of cell deaths. Okay, cell deaths. Where? In the septum primum. So these areas of cell death forms another foramen which is known as the foramen. Now first one was primum, so this will be foramen secundum or ostium secundum. So we have got ostium primum and ostium secundum. Okay, now since the blood can flow from here, this area can be closed, isn't it? So the foramen primum is no longer required because we are having already a foramen secundum through which the blood can flow there. So the septum primum now gets fused with the AV cushion. Okay? Till here it is okay. Again I'll repeat, there was a septum coming down, the septum primum, AV cushion down. This is known as the foramen primum. Okay, before it gets itself attached here, there is cell death to allow the passage of blood, and there is the foramen secundum which is being developed. I hope it is clear by now. Now you
Yes, sir.
see, yeah. Now you see the sinus venosus, the right horn is pushing itself more and more. It is pushing itself more and more to get itself, isko apna jagah chahiye, it want to establish itself. So it is pushing more and more, okay, to get itself absorbed in the right atrium. Okay, so what it does, it spreads more. It spreads more. Okay, it spreads more. It goes like I can say it keeps on moving. Okay, it keeps on moving. It spreads more and more. It spreads more and more like that. Okay, so ultimately what happens? What was this septum? This was septum spurium. Okay, so this septum spurium ultimately comes near and near and near and near and near. Okay, and while it happens, there is another septum which is being formed here, and this septum is known as the septum secundum. Okay, so this is known as the septum secundum. Why this septum secundum appears? Because this is giving more pressure over here. Okay, so the septum secundum also appears. This is the fold, or fold plus an active process. Okay, now the septum secundum will grow more and more and more. Okay, so that it is now overriding this foramen. Okay, now what happens we will see. Now this part, the left side, the septum spurium as well as the left side of the venous valve, this was the left venous valve if you remember, they get fused with the septum secundum. Okay, so there is no septum spurium. Okay, there is no septum spurium, it has gone and got fused with the septum secundum. Okay, so the fate of the septum spurium as well as the left venous valve is that they get fused with the septum secundum. Okay, so there is no more septum spurium and over here the what is left is the right venous valve. So the right venous valve, what happens to it? The upper part of it disappears, only the lower part will keep on expanding and expanding and expanding, since the whole of the sinus venosus is getting incorporated here, isn't it? So when it expands, when it keeps on expanding, then this one, I mean the right horn, the right venous valve, it will come and it will form a valve which is alongside the inferior vena cava, another valve which is alongside another channel, another venous channel which is known as the coronary sinus. So inferior vena cava is opening somewhere here, coronary sinus is opening somewhere here. So what is this? Just I'll write. This is the coronary sinus, a vein which is draining the heart. What is this? This is opening of the inferior vena cava, opening of the. So what is left with the right venous valve, the lower part, is that this forms the valve of inferior vena cava, and it forms the valve of the coronary sinus. Okay, this is also known as Eustachian valve. Okay, these are remnants, and this is also known as Thebesian valve. Okay, till here it is okay. So we have seen what happens with the left venous valve, we have seen what happens with the right venous valve, we saw what happens with the septum spurium. Okay, now let us just remove all these things which are not needed here now. Okay, let it remain, some part of it. Now you see, this is still a channel present for the passage of the blood. Okay, so the blood is going like that. Okay, it's giving pressure over here. Okay, then it moves a bit and the blood reaches the left atrium. Okay, and if you see in the sagittal view, this was septum primum. Okay, so this was supposed to go down and down and down and down to reach to get completed and to reach the AV cushions, isn't it? But before it happened, before this whole of the thing was a septum, what happened? There were some cell deaths. Okay, the cell deaths produced another foramen here. This was what? Come on, tell me now. What was this foramen? What is this foramen? So initially there was a gap lying inferiorly, so that was foramen primum. or ostium primum. So later on through apoptosis, there is a foramen be formed here. So what is this foramen?
Foramen secundum.
Secondum. Okay. Foramen secundum. Now again, after that, what happens? Another septum is lying over it. Isn't it? This is another septum which is lying over it. Okay, so what is this septum? What is this septum? This is septum primum. What is this septum? Septum secundum. What is this? Foramen secundum. Once the septum secundum overlies the foramen secundum, this part is known as the, क्या बोलते हैं अभी इसको? Anybody? Having any idea? This is called the, this is how the foramen ovale will appear. Okay. After birth, through pulmonary veins, when the blood from the lungs, it will come down. Okay, the pressure over here in the left ventricle increases, pushing this septum primum against the septum secundum, and the foramen ovale is closed. Okay, once the baby cries, the blood vessels in the lungs increases. There is blood in the blood vessels in the lung. There is starting of the respiratory system. Since there is more blood output coming through the pulmonary veins, the left atrial pressure increases, closing the foramen ovale. Okay, this is what happens after birth. But sometimes again, it may be patent in some congenital conditions. We will discuss it. So this part, is it clear? Formation. So this is the formation of interatrial septum. This might come as a short note, might be asked. There are so many models. Okay, along with it, there are different congenital anomalies of the heart. Okay, so this is clear till now?
Yes, sir.
Huh?
Yes, sir.
So let us just see. Okay, यहाँ पे वही, so we saw septum spurium, this is the septum primum, this is the foramen primum, these are the cushions, these are the different venous valves. Now it has expanded the right side of the inferior part of the right venous valve, forming the eustachian valve and the Thebesian valve. Okay, then there comes the septum secundum. Now there is the foramen ovale. Once the pressure increases, this foramen ovale khatam. Okay, it disappears. There is no foramen ovale. Okay, now let us see what happens to the right atrium. Sorry, to the left atrium. So if this is the atrium again, okay, we have the septums and all. Now you see from its posterior aspect there is budding of a vein. There is a vein, okay, which is like opening into its posterior wall. Okay, there is initially a single vein, okay, which is opening there, a single vein. Now that single vein is bifurcated. I'll just draw it a little different. Suppose this is the wall. This is the vein opening into it, a single vein. Okay. Now what happens? This vein will bifurcate. These are the process of angiogenesis. Okay, and the proximal part, or you can say the stem will get itself absorbed in the walls of the left atrium, so that we are getting a picture somewhat like that. So these were the walls, okay, these were the walls of the left atrium. And what happens now? The veins are incorporated into it. Okay, soon what will happen? We'll find that. Now there are two veins opening separately. Okay. Again, these two veins will bifurcate and they will push themselves inside the left atrium. What will happen then? We will get a picture, something like this. So there are these veins opening, okay, and soon what will happen? There are one, two, three, four veins opening into the, and they have already contributed in formation of the wall of the left atrium. Okay, what are these veins? These are the pulmonary veins which are opening into the walls of the left atrium. Is that part understood? This part? The same thing happened here when the sinus venosus got itself, okay, incorporated into the wall of the, so this whole thing which was formed due to these venous valves and all, so this whole wall, okay, for the right horn of the sinus venosus was forming. Now there is the septum ये primum, ठीक है, यहाँ पे foramen ovale है, there is the foramen ovale, okay, so this is like that. So this wall is smooth. Why? Because it is being formed by the smooth part, the sinus venosus. Okay, this is the rough part formed by the primitive atrium. Okay, similarly here, this part is, when the four veins are being formed, this part is smooth. Okay, which is being formed by the pulmonary veins. Pulmonary veins. And this part is rough, which is formed by, again, primitive atrium. And this smooth part in adult heart is known as sinus venerum. Okay? And rough part is developed by the primitive. So this is how the atrias are developed. Have you understood the septums and the parts of the primitive atrias? So let us see patapat. So this is the part, the smooth part, the sinus, future sinus venerum. Somewhere here is the smooth part, the future sinus venerum. This is the rough part formed by the primitive atrium. Okay. So what we have got a chamber somewhat which appears. Okay. So in this picture you can see there is the ostium secundum. The ostium secundum, which is formed by the apoptosis or the programmed cell death of the septum primum. Okay, so this is the same septum primum secundum. Okay, maybe this is also the same. Now what we got is a picture. So we have already deal with the atrias. Now let us deal with what happens with the ventricles. Okay, so initially, as I have told you, and I have drawn earlier, this part, what was this part? This part of the heart tube, what it will form? What is this? What is this part?
Truncus
Truncus
arteriosus.
arteriosus. Okay, and this part is the, yes? Right.
Conus cordis.
This is conus cordis. This is the proximal one third. This is the primitive ventricle. These are the two atrias, isn't it? Now, initially, everything was getting communicated with only the left ventricle. But now, what happened? The atrias are having individual communication with both the ventricles. Okay, how? There is formation of the atrioventricular cushions. Okay, this is one, this is another. Okay, and the bulbus cordis, sorry, the conus cordis has gone a little to the more medial side. This is the bulboventricular flange. It is going to the more medial side, so that this will form the outflow, isn't it? Outflow of both the chambers, both the ventricles. So it has to come in the midline, isn't it? So initially, again, you see, initially only from the right side to the left side, then the atria are getting connected. But now, due to the fusion of these cushions, this is the superior and the inferior endocardial cushions. When they get fused, there are two separate atrioventricular canals. Okay? So again, we see in the sagittal section, this is the atria, sinus venosus opening. Here, this part we have already seen. This is the ventral and the dorsal endocardial cushions. They are coming and getting fused with each other. So on that side there is an opening, and this side there is an opening. So individual atrias. So there are two AV channels, atrioventricular channels. Okay, this the same. Now the same. Okay, this is what? This is the outflow. These are the ventricles. These are the AV cushions. This is the atrias. Now see, formation of these cushions happens in a formation of the septas. Okay, we need septas in the atria, we need septas in the ventricles, so that the two atrias are separate, the ventricles are separate, isn't it? Again, we need septa between the atria and the ventricles. Now the formation of this septa happens by two methods. One is active, one is passive. Okay, in active method there is an active growth of the tissue. Okay, like the endocardial cushions, one will come from front and back and they will fuse with each other. Okay, next is a passive. Next type is passive. In passive, what happens? I missed that picture, I think. Okay, I missed that picture. Anyway, I'll just draw that. So in active, what happens? There is this chamber. There is a part coming from here. There is a part coming from here. They are coming together, and there is a septum which is being developed. This is the active process. So this is one AV, another atrioventricular, right and left atrioventricular channels. Okay, but what happens in ventricle, as per say in ventricles, what will happen? There is a septum which is developed. There is a septum. This is a muscular extension from one part. Okay, now once this is formed, the growth of it individually is negligible. In fact, what happens is that the chambers, they grow and they oppose. These chambers, they will grow, grow like that. Okay, these chambers will grow like that, they will grow like that. This is a passive method, and this growth will add up to the septum. Okay, this is the passive method. Now there is the septum which is, okay, grown a little bit passively, not actively. So these are the two methods. So the first one is the atrioventricular fusion of the atrioventricular cushions. The second is the formation of the muscular part of the interventricular septum. So between what happened between the atrias we have already seen, isn't it? We saw what happened in the how the septum primum secundum evo it came and all. But here, this is the muscular, say intraventricular septum has got many parts, three parts basically. This is the muscular part which happens to grow through passive process. There is another thing which is coming up between the atrias from posterior, यहाँ पे this wall में anterior. So these are the atrioventricular cushions. Okay, यहाँ पे आके septum primum ऐसा लगा था, यहाँ पे septum secundum ऐसा, isn't it? Now these two cushions are moving towards each other, plus there is a gap here. Okay, and another thing you should remember, this is what we are seeing from the posterior. Another thing, we are still having this part. We are still having this part. ये क्या है? ये outflow है, which is anterior to it. You getting my point? This part. So if you see it sagittally, this is the outflow, this is the atrium, this is the ventricle. Okay, this is the outflow, these are the atrias, ventricles. Where is this? This is the passively formed muscular part. What we are supposed to form here, what we are seeing, how the interventricular septum is formed. So once you see this, I think you will be little clear. So this is the muscular part, an outgrowth, and later on a passive process. What is happening between the atria and the ventricles? The atrioventricular cushions are coming. Okay, they are moving towards each other. What is next to be seen? There should be a septum. So this is the common chamber. Now this has become a common chamber here, and there is a different chamber there, isn't it? So there needs to be a septum here also. Okay, so how many parts? This is 1, this is 2, and this is 3. So through 3 parts, the whole of the interventricular septum will depend on the 3 parts. The first is the muscular part. Second is the AV cushions. What is the third? This is known as, in simple word, the spiral septum. This is called the spiral septum. So already a septum has developed between the atrias. Okay, blood has to flow to the atria on that direction and this direction. Okay, now this is the interatrial septum, isn't it? Now it should be meeting with the interventricular septum, so that now there should be a canal on that side and this side. This is what we are seeing in sagittal view. Okay, now let me just show you a picture here. Okay, you just see this picture. This is the right ventricle, this is the left ventricle. Okay, this is the muscular extension, muscular part of the interventricular septum. This is the superior endocardial cushion, this is the inferior endocardial cushion. Now there is this big gap. So the right ventricle should be communicating with what? The pulmonary trunk. The left ventricle should be communicating what? The aorta. So the outflow should be separate. But now what is happening here? This part, the truncus arteriosus and the conus cordis are a single chamber. So a septa should be there also. A septa should be there which should be getting communicated with the ventricles. Okay, so that the right ventricle is opening to the pulmonary trunk. The left ventricle is opening to the aorta. Isn't it? So the septa in the ventricles should be in congruity with the septas which are there in the outflow tract, that is the bulb, conus cordis and the truncus arteriosus. Is it clear now? So we need septas in the ventricular chamber. We need the same septa to be going all around the outflow to the pulmonary trunk, all around the outflow to the aorta. Okay? So plus that those atrias, they should be coming from that side. The interatrial septum should be attached here from the back side. Okay, if this is this side, suppose is the left ventricle, so this should be communicating with the aorta. If that side is right ventricle, that should be communicating separately with the pulmonary trunk, isn't it? So muscular part, endocardial cushions, and the spiral septum. Three parts which will form the complete septum between the two ventricles and their outflow. Okay, I'll try to draw as far as possible. This is right ventricle, this is left ventricle. They are communicating with the respective, okay, the septa. So here is the endocardial cushion. This is the muscular part of the interventricular septum. Okay. From here comes the inferior endocardial cushion. So this is the muscular part, muscular septum. These are the endocardial cushions. Is this picture okay now? It's the same picture which we saw here. So there is a muscular part, there is the endocardial cushions. Okay, now so that there is a different chamber, different passage for the right and different passage for the left inflow, and different outflow passage for the right and different outflow passage for the left. Okay, now along with it there develops a septum which I talked about is the spiral septum. Okay, now why it is not clear I can understand now, because you are not clear about the anatomy of the heart since it's not yet started. You see, when you see the anatomy of the heart, if you open it, the heart, if you open it, okay, the pulmonary trunk lies like that. Okay, it divides into two parts and it is draining what? If you just cut it down, you will see it is draining the right ventricle. Okay, it is draining the right ventricle like that. Okay, somewhere here is the atrius. Okay, now for the left side, this is suppose the left side, there is this aorta, okay, which is coming like that, passing over it like that, isn't it, and going to the left side, isn't it? So the aorta is crossing like that, okay, like that. So this and this. So the aorta, if you cut it down, you'll find the outflow of the aorta is through the left ventricle. Outflow of the pulmonary trunk, both the sides, is through the right ventricle. Now is it clear? Huh? So we need a septa which was there, which is being produced, the muscular part, through the muscular part. Okay, somewhere here is the cushion, atrioventricular cushions, both right and left. Okay, so two components already done. And third, so this, what was this? This was a common chamber. This was a common chamber, isn't it? This was a common chamber. What was this chamber? What was this common chamber? This was the truncus arteriosus, isn't it? What was these areas developed from? This area developed from this area. These are the outflow. This is the outflow. From where they are developed? They are developed from the conus cordis, isn't it? Now the conus cordis as well as the truncus arteriosus should be divided. They should be divided, isn't it? To maintain the outflow. So again, let us again. So this they should be divided, isn't it? So how they should be divided? The pulmonary trunk. This is the pulmonary trunk. If you see it from the front, it lies anteriorly. This part of the pulmonary trunk, you can see it from the anterior. After that, where it is going? It is going to the left side. Okay. After that, again, it is coming to the anterior. Okay. For the aorta, first this part is lying. For the aorta, it is lying posteriorly. After that, it is going to the right. Then it is again going posteriorly. You're getting my point? So this septa, which is formed in between them, is not straight. It is a little curved. Okay, like this, going to the left and like that. Isn't it? Aorta posterior to the right and like that. So this septum, which is continuous, which should be continuous down with the AV cushions, this septum is known as the spiral septum. Is it clear a little bit now? Yes?
Yes, sir.
Huh? So now you see, this is the muscular part. This is the muscular part. This is the superior AV cushion. This is the inferior AV cushion. Now a septum is being developed in the conotruncal region. I am saying conotruncal, conus cordis and truncus arteriosus. Conotruncal septum. Conus cordis is forming this part, the outflow of the both the ventricles. Truncus arteriosus is forming the proximal part of the pulmonary trunk and the aorta. So conotruncal septum. You see this green and this yellow thing is how the conotruncal septum is formed. A little spiral, okay, so that the blood from the right ventricle moves like that. Initially you can see the pulmonary trunk in front. This is the pulmonary trunk, the lumen of the pulmonary trunk, which you can see in front. Then it goes back. Okay, then it goes back. Then it goes to the right, then it goes back. Okay, so if you cut it over here, this is the septum. So similarly, aorta, it is posterior side, you cannot see it from the front. Then it comes to the right, then it comes to the front. Okay, so if you cut it over here, you will see a septum which is like this, crossing like that. If you cut it here, you will see a septum crossing like this. If you cut it here, you will see a septum again coming like this. So this is the spiral septum. So here, if you see, this is the pulmonary trunk. This is the aorta. So this is the pulmonary trunk. This is the lumen of the pulmonary trunk, the blue one. The blood flow, it is denoting the blood flow from the pulmonary trunk. Posteriorly, you cannot see anything here. Can you see anything? Because it is hidden. So this is the aorta. Again, if you see it over here, you'll find on the right side it is the aorta, on the left side it is the pulmonary trunk. Again, you move up, you see the aorta comes in front, and posteriorly there is the pulmonary trunk. So it is the septum itself is spiraled and this happens due to the flow of the blood. Okay, due to the flow of the blood itself spirals the septum. And after this, what will happen? The spiral septum is formed, the AV cushions are fused, and this is the muscular part of the intraventricular septum. Now still there is a gap. This gap is being filled up by proliferation of the inferior endocardial cushion. So this somewhere here is the inferior endocardial cushion. It proliferates and fills the gap. It proliferates and fills this gap. Okay. So the whole of the conotruncal septum, the endocardial cushions, and the muscular part of the interventricular septum helps in formation of the outflow. The septum between the outflow, the interventricular septum thus had got three components: muscular component, endocardial component, and the conotruncal component. And lastly, this gap is being, it's usually asked, the gap between them is filled by the proliferation or outgrowth from the inferior endocardial cushions. So this is how the septum is being formed by in the ventricles. So we saw how so again the last time I have tried to show a model. See, this is the septum. Okay, this is the conotruncal septum, this green thing, and the arrows which I have given, this is the chamber of this is just representing the right ventricle. This is the pulmonary trunk. Okay, at first it lies anteriorly, then it goes to the left side, then it comes up anteriorly again to the back. Then for the aorta, okay, they should have been यहाँ से निकल गया वो. So at first you cannot see, it lies in the back, then comes to the right, then anteriorly. This is how the spiral septum is being formed. Do you understand? Till here, is it okay?
Yes, sir.
Anyway, so
Sure.
okay. Now you see those the formation of the atria, the formation of the ventricle, the septa in the atria, the septa in the ventricles are done. Now the spiral septum is done. Now we can have, so one more important thing, the neural crest cells are an integral part for the endocardial cushion and the conotruncal septum. Matlab, this part, the neural crest cells are an important part for these endocardial cushions and this conotruncal septum. So when there is a problem with the migration of the neural crest cells, which are also incorporated into the lips, the palates, so usually with the cleft lip and cleft palate, there is, along with it, you should, if you find a patient of cleft lip and cleft palate, that is because of some problems with the migration of the neural crest cells. You should also be looking for the congenital cardiac defects, because the same neural crest cells are there in the endocardial cushions as well as in the conotruncal septums. Okay, so this is how, as I have told you, in the left atrium, how the smooth part, the sinus venerum part is developed. This is about the formation of the cardiac valves. You see, this is a chamber, okay, of the myocardium formed by primitive. So here what happens, there are some areas which get washed away, okay, flooded by the blood inside, then they get eroded. Once they get eroded and erode, some part of it elongates, forms the papillary muscle, rest of the part is replaced by the fibrous tissue forming the chorda tendineae, and whatever remains in the mesenchymal cells above will form the valves. This is how the cardiac valves. In the semilunar, there are outpocketings. See, the cardiac valves, this I am talking about the AV valves, atrioventricular valves, in the right and the left side. In the right side there are three tricuspid. In the left side there are two, isn't it? The mitral valve and the tricuspid valve. Now this is the valves which are present in the aorta and the pulmonary trunk, and these valves are known as the semilunar valve. Okay, these valves in those chambers first come as outpocketing, then due to the blood flow and pressure of the column of blood, they are seen to be having some indentations, and later on they are shaped like a cusps, okay, semilunar in shape. So this is how the valves of the aorta and the pulmonary trunk are being formed. Now there are different congenital cardiac anomalies which are there and very much common in live births as well as stillbirth. Okay, so we will discuss some of them, the important ones. So the factors for them are various, like the torch, toxoplasma Okay, rubella, cytomegalovirus, herpes virus, these are infections which can occur during pregnancy and which may lead to the cardiac disease, congenital cardiac disease, and there are some other components like the environmental factors like lifestyle factors like taking alcohol, some drugs like thalidomide, okay, lithium injection. So these all may lead to cardiac anomalies. The first thing here which we will discuss is the dextrocardia. Dextrocardia, matlab ulta. The heart lies on the right side. Which part which we have discussed might be responsible for it? Any idea? So what happens during the looping of the heart, when there was the looping, if you can remember, I told you the superior part comes, so during the loop formation, the superior part comes down and to the right, the inferior part goes up to the left. Now that if it happens the ulta, the superior part comes to the left and the other part goes to the right, then there is a condition which is known as the dextrocardia. Okay, the heart on the, as you have seen in the movies, the heart on the right side. Now that dextrocardia may be associated with all the structures to the left, like the mirror image, or it may be associated with only the heart. Okay, so that is known as dextrocardia with situs inversus, with or without situs inversus. Situs inversus is a condition where the whole of the body is thus the mirror image, which I will show you here. You can see in this picture, this was a cadaver which we dissected. You can see the heart to the right side. You can see the liver in the left side and all the other structures. Sub ulta. So this is situs inversus for the heart, sorry, dextrocardia for the heart, along with the situs inversus, also known as the situs inversus completus. So there is a problem with the looping. Second is a condition which is known as ectopia cordis. Now this has something to do with the ventral wall defect. It exactly doesn't come in purview of this class. We will discuss it sometime later. Now we see the atrial septal defect, ASD. So there is some problem with the septas in the atrias. Okay, as we have discussed earlier, what was this? This was septum primum. What was this? Okay, this is septum secundum. Sorry, this is the septum primum. Since the secundum is, you are seeing it from the right side, so the septum is overlying the septum primum. So this is the secundum. So sometimes there might happen that there is a patent foramen still remaining over there. A small part of it is not yet, okay, fused. So that is known as the patent foramen ovale. Sometimes for a small foramen ovale there is not much problem. Okay, but of course when there is problem with the circulation, now this type of patients needs treatment. The second is ASD. Usually the atrial septal defects, it happens with the ostium secundum. If you can remember, the ostium secundum was when the apoptosis happened in the septum primum. Okay, so there is a gap. Okay, there is a communication with the right and the left atrias, or there can be of ostium primum defects, but ostium secundum defects are more common. Then VSD, ventricular septal defects. Now as we have discussed, there are three components: one muscular, membranous, conotruncal. Now the membranous part of that thing of the ventricular septal defect, the defect is more common if the membranous component is involved. Okay, here you can see a ventricular septal defect. This is the muscular wall, no problem with that. But main problem with the membranous part. Okay, so this is the ventricular septal defect. So these, okay, we'll skip this. So you can again see in this picture, this is a specimen, I think, picture of a specimen where you can see a patent foramen ovale. Now, there can be, as I have already discussed, persistent truncus arteriosus. So no spiral septum has developed here. Okay, now this is a single chamber, common chamber. Okay, the aorta, the pulmonary trunk, since there is no spirally, no septum down here, aorta is more towards the right. Pulmonary trunk is more towards the left because there is no spiral septum developed here. This type of condition is known as the persistent truncus arteriosus. Okay, Blood commonly flows to all of both of them. So this is the persistent truncus arteriosus. Okay. Next is transposition of great arteries. What are the great arteries? The aorta and the pulmonary trunk. Transposition matlab their position have changed. The septum is not spiral. It is present, but it is not spirally developed. It is developed straight. So now the aorta is opening into the right ventricle. Okay, and the pulmonary trunk to the left ventricle because the septum has failed to form the spiral architecture. Next is a condition which is known as TOF, tetralogy of Fallot. Usually happens with the ventricular septal defect and the problems with the conotruncal septum. Now there are four components: 1, 2, 3, 4. First, there is pulmonary stenosis. This is the pulmonary trunk which is arising from the right ventricle. So there is stenosed part of the neck, I mean the mouth of it, where the proximal part of it is stenosed. Okay, that area is allowing less amount of blood. Okay, so this is the pulmonary stenosis. Second is the ventricular septal defect in the mostly in the membranous part. See, the muscular part is okay, the membranous part is not present. So once there is the ventricular septal defect, there is the aorta which is overriding it. It is overriding it just above it. And the fourth one is due to this pulmonary stenosis, since the right ventricle is trying hard to push the blood because of a narrow passage, there is enlargement of the musculature of the right ventricle, and the fourth component is enlargement of the right ventricle. So these four components together forms the tetralogy of Fallot. Okay, this is a normal ultrasonography where you can see the different chambers of the heart. Okay, with the septum in between. Okay, this is the interventricular septum, interatrial septum. Okay, these are the valves with the canals. So your class is done. If there is any doubt or I need to repeat anything over here, you can ask me. Okay?
Okay, thank you, sir.
Thank you, sir.
Yeah, yeah.